Hi, I'm Ryan Nutter, CEO and Principal of Cornerstone Senior Advisors, and as we say in our office all the time, Medicare is the air we breathe. In this video, I'm going to discuss with you a Medicare Supplement Plan N. What is a Medicare Supplement Plan N? How does it work with Medicare? Before we get into that, I'm just going to dialogue a little bit about Medicare, original Medicare, to paint a picture of why someone would get a Medicare supplement and how a Plan N would fill a lot of the gaps you're left with Medicare. When we talk about Medicare, there's two parts, Part A and Part B. Part A is your hospitalization, and all these years you've been working and you're paying taxes. The portion of your taxes that go towards Medicare pay for Part A. So Part A has already been paid for. I never tell anyone Part A of Medicare is free because it absolutely was not free. You absolutely paid for Part A of Medicare. It's just already been bought. It's already been paid for. So Part A of Medicare, your hospitalization, you've already purchased. So you turn 65, you're entitled to Part A of Medicare, you sign up, and there's no premium going forward. So what does it cover? And what do you have to pay? What's your exposure? When you're admitted to a hospital, day one, you have a hospital deductible of $1,600. This will cover you for up to 60 days. The catch with this deductible is it's not annual. So if you're admitted to a hospital, you pay that $1,600, you're there for a few days and you go home, and let's say a couple months later you're back in the hospital, you pay this deductible again. So you could pay that deductible several times in a year if it's a rough year health-wise for you. If you're in the hospital for over 60 days, well, now you have a per day copay of $400. And if you're in there over 90 days, that per day copay doubles to $800. Skilled nursing is also under Part A of Medicare. Now, the first 20 days of skilled nursing is covered. You have no out-of-pocket. Medicare is going to fit the bill for the first 20 days. After those 20 days, now you have a per-day copay of $200. Now, what is skilled nursing? Skilled nursing is not long-term care. It's not nursing home coverage. Skilled nursing is basically a place to recover. So let's say you've had a life event. You've had a heart attack, a stroke, or let's say you had a surgery, you had a hip replaced, and your doctor says you're stable, you're just not quite ready to go home yet. Well, oftentimes, this is when they're going to send you to a skilled nursing facility, basically to recover. So you'll have registered nurses taking care of you, you'll have physical therapy, speech therapy, occupational therapy, so on and so forth, until you're ready to go home. Medicare covers the first 20 days. After 20 days, you have a per day copay of $200. That's some of your out-of-pocket exposure with Part A of Medicare. Now, Part B of Medicare, the other half of Medicare, is everything outside the hospital, basically. So your primary care doctor, specialist, emergency room, outpatient procedures even, so on and so forth. So Part B of Medicare does come with a premium. In 2023, which is when we're recording this video, your monthly premium is $164.90. And I say standard premium right here because that can go up based on income. They're going to look at your income from 2 years prior and determine what your premium is. So if you're concerned, you may end up having to pay more than the standard $164.90 a month. Give us a call. We'll walk you through what income bracket you might fall into to determine what your Part B premium is going to be. So $164.90 is what most people are paying, and that's for Part B of Medicare. Now, if you're drawing Social Security, they're just going to take this $164.90 out of your Social Security check automatically, and they're not going to ask you otherwise. That's just what they're going to do. If you're not drawing Social Security, you're going to pay this quarterly. So you're going to pay that take $164.90 times 3, and you're going to pay that every 3 months for Part B of Medicare. So that's your first Medicare expense. Now, Part B, again, is everything outside the hospital, and it has its own deductible of $226. So you're going to pay the first $226 a year. It's different from your hospital deductible because it's annual, so you're only paying it one time a year. It's an annual deductible. So you pay the first $226. Once that's been paid, now Medicare is going to kick in. They're going to pay 80%. You're going to pay 20%. So anytime you go see a primary care doctor, a specialist, emergency room, even if you go in, you have an outpatient procedure and you go home the same day, you're paying 20%. Now, the big catch with Part B of Medicare, the biggest issue is there's no max out-of-pocket. That means you have no ceiling to your out-of-pocket exposure. So if you have something come up, you're going in for regular treatment for several months, well, you're just going to keep paying 20% without any end in sight. This is why people get a Medicare Supplement Plan. They're also called Medigap policies because we're filling the gaps of Medicare. So what the government did is they designed this chart of 10 Medicare Supplement Plans. And they tell all these private insurance companies, if you want to offer a supplement to Medicare, you can, but it has to be one of these 10 plans. So these companies can't make up their own supplemental insurance to Medicare. I'm sure you get bombarded with solicitation and mail, and they're basically all offering the same things. They're just packaging it differently because the government designed these plans. So if these companies are going to offer a supplement to Medicare, they can choose which of these 10 plans they'd like to offer, and then they can decide how much premium they'd like to charge. But coverage-wise, so in this video we're going to talk about a Plan N. Well, a Plan N is a Plan N is a Plan N. It doesn't matter which company you get that Plan N from. They all have to abide by the government's rules. So they got to pay how a Plan N was designed to pay, and they have to cover how a Plan N was designed to cover. But they can all charge different premium. This is where it's really important to work with an independent advisory shop like ourselves, like Cornerstone Senior Advisors. We're independent. That means we can dialogue with you on every company out there. We're not tied to one company. We're not tied to a bottom line. What I tell people is we are brokers, and that means we work for you. An agent works for the insurance company, a broker works for you, because we can work with any of these companies. If one company gets out of line with their rates, we'll just fire them and move you somewhere else. So we really work for you, making sure you get the plan that you want at the right price. So let's look at a Plan N and how a Plan N works with Part B of Medicare. Again, Part B of Medicare has this deductible of $226, and you do have to pay that deductible when you have a Plan N. But remember, it's an annual deductible. You're only paying that deductible one time a year. Once that's been paid, now Medicare is going to kick in and they're going to start paying their 80%. With a Plan N, you're just going to have copays. Now this says up to $20 because oftentimes your copay is less than $20, but it's never more than $20. So if you go to a primary care doctor, the most you'd pay is $20 copay. If you go to a specialist, the most you'd pay is a $20 copay. Oftentimes it might be $15. A lot of times it's not $20, but that's the most it can be. If you end up in the emergency room, which is not in here, with a Plan N, if you end up in the emergency room, then your copay, the most it can be is $50. So you have a copay with a Plan N. That's a little bit different than what you see with a Plan G, than what you see with a Plan F. You have some of these copays. Outpatient procedures, they are going to cover your 20% in full. Durable goods, your knee braces, your oxygen tanks, things like that, they're going to cover your 20% in full. Now, I want to mention a couple of things about a Plan N before we wrap up this video. The first thing is this Part B excess charge. What's the Part B excess charge? Well, if a healthcare facility accepts Medicare, that means they accept the Medicare approved amount for the services they provide. So Medicare is basically telling them, this is how much you can charge for the services that you're providing. And if they would like to, they can charge up to 15% more than what Medicare assigns them. If they chose to do that, with a Plan N, you do have to pay that 15% excess charge. The Plan N does not pay that for you. That's something that intimidates people away from the Plan N sometimes because it's an unknown. You don't know if that's going to come up. But I want to say a couple of things to that. One is you rarely see any healthcare facility take advantage of this excess charge. Our office is in Kansas, and I don't recall any moment where I've seen a healthcare facility in Kansas take advantage of that excess charge. I'm not saying it doesn't ever happen in some states, but it's not common. 10 years from now, maybe that's a different story. To this point, it's not been a huge issue. The other thing I would say is it doesn't apply to your hospital stays. This Part B excess charge is only applying to Part B. It's outside the hospital. So it's your primary care doctor, specialists, emergency room visits can apply a Part B excess charge of 15%. It can get bigger maybe with outpatient procedures and things like that where they're charging an excess charge, but it doesn't apply to hospital stays. So those are the two things I want to mention with that Part B excess charge. Now, the other thing I wanted to say in wrapping up this video, I really like this plan. I think there's a real fit for it. It's a great value, but I want to mention it doesn't matter what Medicare supplement you have. your rates are going to go up over time. They all do, and it's unavoidable. When you look historically at rate increases, the Plan N does not go up as fast as a G or an F. So they've been a little bit more stable, and that's one thing I like about a Plan N, is it creates some of that stability. Now, we can't predict the future with a Plan N, so we can't tell you for sure what rate increases are going to look like with the plan, but like people say, the best indicator of the future is the past, right? And historically, the rates don't go up quite as fast as other plans. So that's a benefit with a Plan N. I do want to mention it's also, there's no network with this plan. When you combine a Plan N with Medicare, you can go to any doctor, any hospital, anywhere in the US, and you're covered. Anywhere in the US that takes Medicare, a healthcare facility, they are also going to take this Plan N. It's really dynamite coverage. It's an excellent option. If you want to dialogue more, if you want to see what plans are available in your area, if you want to see what rates are available in your area, just give us a call, 316-260-3331. I also want to mention, if you would like a free copy of my book, Medicare Made Simple, call us today, 316-260-3331. Just request a copy of this book. We'll get your address. We're going to ship it to you. We're going to break down in this book, chapter by chapter, different aspects of Medicare, original Medicare, Medicare Supplement Plans, Medicare Advantage Plans, drug coverage, so on and so forth. And we really try to simplify it with a goal of you feeling informed enough that you can make an educated decision that you feel confident in. So if you'd like any more help, don't hesitate to reach out. We want to be your Medicare resource. I hope this video was helpful for you, and thanks for watching.